Eleanor has a healthy 18-month-old son, but the experience of giving birth at Edinburgh Royal Infirmary last year was traumatising. She told me she was left in a side room without a midwife until the very final moments of her labour.
When I got into the labour ward, they had no idea how long I'd been pushing for. And they were saying, you just need to push harder, you need to push faster. It felt really panicked and rushed. And then when the baby was delivered, he came out in one movement, almost fell on the floor because there was no midwife near me, no hands near me. And I had a 3C degree tear, which is one of the worst degree tears you can get.
Eleanor believes the root of her experience was inadequate staffing levels, a point highlighted previously by whistleblowers and again when inspectors visited the unit this summer. This is Scotland's busiest maternity unit. 5,500 babies are born here every year, and while the vast majority, of course, are delivered safely and without incident, this unannounced inspection report raised what it called serious concerns about culture, the oversight of patient safety and staff well-being. The Health Board has recruited an extra 70 midwives who should all be in place by the end of the year. Work has already started to address culture and help staff feel supported, but the Chief Executive told me it's important to get things right.
But because we are co-producing the solutions with staff, with people who use the service, I am content that we do that diligently and well, and it takes us a little bit longer rather than we rush things through and it doesn't have the intended impact for colleagues and for service users.
I still have significant concerns about the pace and the momentum of change, and I am clear that we must see urgent improvements. That is why the Scottish Government has taken the decision to escalate NHS Lothian maternity services to level 3 of the NHS support and intervention framework.
Today's report does highlight positives too. It says inspectors saw staff working hard to provide compassionate and responsive care in very challenging circumstances. But it's clear there's still some way to go to restore confidence from women like Eleanor.
I really would like another child, but I can't imagine giving birth again. I can't imagine voluntarily going into the hospital. It does bring back all those memories of just the being left alone during the time when I was most vulnerable, probably my entire life, when I most needed someone there to watch out for me, when I wasn't able to advocate for myself, and that they let me down.
Well, with us now, the midwife and author Leah Hazard. Thanks so much for joining us, Leah. What was your reaction to that report into the Edinburgh maternity unit?
Well, obviously the findings of the report are alarming and concerning, but unfortunately not surprising, I think, for anybody who has been working in any aspect of maternity across Scotland or the UK for the past several years, because we've known for a while that these issues are present. I think people have tried to raise concerns, so unsurprising, I would say.
So you've been a midwife for over 12 years. When you speak to colleagues and friends, you're hearing a similar picture right across the country.
Absolutely. I can't really speak to my own personal experience at work, but I am hearing from midwives all across the country in many different units. And the message is really the same, is that they are under incredible pressure. Staffing has been an endemic issue across Scotland, excessive workloads, complex workloads. So I think a lot of the issues raised in this report will be very familiar to midwives in many different environments.
The unit in Edinburgh says they're going to have 70 extra midwives in place by Christmas. And is that feasible? Is that possible?
I would love to think that it is possible. Every year across Scotland, hundreds of newly qualified midwives join the workforce. They have historically had trouble getting jobs in Scotland, so I'm not sure all of a sudden how that situation has been resolved and this magic midwife tree has been created and these jobs have been created and taken up. But I hope that those promises are true.
So you've said that this problem is right across the country. How have we come to this?
I think it really speaks to a broader misperception of maternity as being really kind of some niche women's issue that doesn't affect society as a whole. I mean, obviously it should be important enough if 50% of the population, are women. But I think what people forget is that literally everyone is born. Birth is an experience that we all go through. It's fundamental to our individual short and long-term health and also public health as a whole. So it shouldn't really be viewed as this kind of niche sort of sideshow in the NHS. It should be viewed as a really central tenet of public health and resourced as such.
And what are the consequences of it being seen as a niche department in medicine?
Well, I think when something is regarded as a bit of an afterthought, it gets resourced as such. And we've seen that, chronically through successive governments in Scotland and across the UK, that there are promises to fund maternity, there's lip service paid to, what a wonderful fundamental part of the health service it is. But the commitment just doesn't follow through. There doesn't seem to be any accountability. So I can only hope that reports like the one today will actually initiate some real commitment to change.
So are the problems we're seeing today a result of many years of underfunding?
I would absolutely say that, yes. And again, promises have been made and funding has been, designated, but through the pandemic and changes of governments and other factors, these programmes just don't seem to materialise.
I mean, it's an incredibly demanding job at the best of times, isn't it? There's so much responsibility and a lot to do. It's an incredibly difficult job.
Absolutely. I think there's, again, a misperception of what midwives do, that we just kind of smile and cuddle babies and just catch babies and kind of that's the end of it. But it is a really complex, highly skilled, pressurised role. We deal with not only straightforward pregnancies, but very, very complex situations. We liaise with the medical team. We work with many other agencies out with the health service. And so, we would like to think that our role is resourced as such. We are capable of doing an excellent job for women and families if we're given those resources that we need.
So what are the consequences then of being so under pressure, so stressed?
Well, I think many midwives in today's NHS would agree that the consequence is just not being able to give each woman or each person the time and the energy that they really deserve. We're trained to be able to provide an excellent service, and we go to work every day or every night to do a great job and to help people. But it really takes an immense toll on midwives not to be able to do that, simply because they don't have the resources and the facilities and the time that they need to do that job.
So is it all about having extra staff, or what needs to be done to improve the services?
Staffing is a huge piece of the puzzle, and I mean, even the report today from Edinburgh recognised that midwives were trying to deliver, I think that the words were compassionate and responsive care, but when there just aren't enough of us to go round, we can't do that. It doesn't matter how good your workplace culture is, but if you're meant to have 10 midwives in a department and there are 5, it's not safe.
Very briefly, just to finish, what words of reassurance can you give to women who might be a bit worried about going into hospital?
I can understand people being, of course, concerned, after this week's findings, but I would say that the vast majority of midwives and medical staff, go into maternity every day to help. And
highly trained, and it's a difficult job. But thank you so much for joining us this evening. We appreciate it.